The internal organs and tissues in the belly are held in place by a tough outer wall of tissue called the abdominal wall. An abdominal wall hernia is an area in that wall that is weak or torn. Often when there is a hernia, organs or tissues that are normally held in place by this abdominal wall bulge or stick out through the weak or torn spot. The size of the bulge can change depending on how much pressure is put on the abdominal wall. For example, straining when coughing or having a bowel movement can make a hernia look bigger. Lying down at the end of the night can make the hernia look smaller or even disappear in the morning. What symptoms will you experience with an abdominal wall hernia? A bulge on the abdominal wall, pain, especially when coughing, straining, or using nearby muscles, a pulling sensation around the bulge, nausea and vomiting, or if part of the intestine is blocked in the hernia. Hernias can hold a looped small intestine, which should normally be tucked inside the belly. This can be painful and even be dangerous if the tissue in the hernia gets trapped and unable to slide back into the belly. When this happens, the tissue does not get enough blood, so it can become swollen or even die. How do we diagnose an abdominal wall hernia? In most cases, we can diagnose a hernia just by doing an exam. During the exam, we might ask you to cough or bear down while pressing on your hernia. Now this might be uncomfortable, but it is necessary in order to find the source of the problem. Most of the time, the contents of the hernia can be reduced or gently pushed back into the belly, but sometimes the hernia gets trapped and won't go back in. If that happens, the tissue that is trapped can get damaged. How do we treat an abdominal hernia? Not all hernias need to be treated right away, but many do need to be repaired with surgery. The two types of surgery are, one is open surgery, one big incision near the hernia itself. We can push the tissue back into the abdomen if it is healthy. Sometimes a piece of tissue needs to be removed. Next, we will sew the layers of the abdominal wall back together so that nothing can bulge through. Then we place a patch of mesh. The mesh takes some of the strain off the abdominal wall so the hernia is less likely to happen again in the future. The second type is minimally invasive surgery, which takes some smaller cuts in the belly in which we insert long, thin tools. One of the tools has a camera called a laparoscope on the end. This will send pictures to a TV screen. We can then look at that screen to see the inside of the body, and then we use the long tools to do the surgery. The right surgery for you depends on a couple things: the size of your hernia, where in the abdominal wall it is, whether this is the first time it's getting repaired, what your general health is like, and your surgeon's experience. What are the risks of a hernia? Less than 0.5% of people get wound infection, lung infection, urine infection, kidney injury, blood clot, bleeding, heart complication, or stroke. And about 1% have damage to the bowel. 10% have stroma, hematoma, or recurrence. You can help lower the chance of recurrence by making sure that you maintain a healthy body weight, keep other health conditions like diabetes under control, avoid heavy lifting after surgery, and quitting smoking.